My first job was working as a nursing assistant in the hospital when I was 16 years old, and then I went on to nursing school and um, went almost immediately into long-term care. Generally, the decision of where a person is going to go is usually made by the family member. Um, Unless the resident or prospective resident themselves has voiced a choice to the family beforehand. Usually, when a person is coming into a nursing home, it's rather sudden. Usually, it's associated with some form of an acute illness. They go into the hospital. They're in the hospital for 3 or 4 days, and the hospital discharge planner comes to them and says, "You can't go home. You need some rehabilitation, or you're not safe to go home. You need to look for a nursing home." And at that point in time, they may have 12 hours to make a decision. Because if they've reached their highest level in the hospital will no longer get paid, and they have to be discharged. Um, I think it would be very helpful to both the family members who have to make the decision as well as the residents if they would familiarize themselves with different facilities uh, way before there's any need for it. I mean, all the residents in a nursing home love having visitors. They can come in and volunteer, or they can sometimes do it through their churches. Um, get out there and see what's out there way before the time comes, and meet with the residents, talk to the staff. Um, I think in making the decision of where you're going to go, it's most important that you spend a little bit of time with the staff and, you know, ascertain that they really do care about the residents. Um, Talk to the residents and see how satisfied they are. Smell a facility. Are there strong odors throughout the facility? Not the transient odors that occur everywhere, but permeating odors that indicate that the place is not clean or that the residents may not be taken care of. Taste the food. Ask for a test tray. Um, Chances are, if a facility will even charge you, it might be $2. Taste the food, see how you like it. Take the menus are posted generally in most facilities. You can review the menus. Take a look at the activity schedules and what kind of activities are available to the residents. They should be diversified to meet residents having different needs. Look at the therapy services. What therapy services are available? Ask about the type of residents that the facility has. Are they the same? Do they have the same type of needs that the individual who needs placement may possibly have? Is the facility familiar with the treatment of that type of person or those type of illnesses? But in a skilled nursing facility with a 24-hour license coverage, there's always someone there to watch for these things. And that, in combination of, good food, 3 meals a day, nutritional supplements, regular administration of medications, the strengthening of muscles through physical and occupational therapy, the identification of problems such as swallowing deficits by a speech therapist could be very significant in bringing someone back nutritionally. It's kind of a combination of all these things that can help the individual to eventually return home.